All right, Mr. Pete Williams, welcome to the podcast.
Al, good to be back with you, mate. It's been a while.
Yeah, I can't believe how long it's been since we would have been together face to face with everything obviously that's happened, but it's nice to connect even if it's over a screen.
Yeah, it's been a while, mate. And congratulations on the little man. I'm following his life on your Instagram. So he looks like you, big time, doesn't he?
It's so interesting to hear people talk about who he looks like.
Yeah.
So some people think he looks like me, some he definitely looks like his mum's mum. Like it's a spitting image, which is a little bit worrying for Katie when she's breastfeeding him and then seeing her mum there. But yeah, it's been a lot of fun.
Good man.
But on to you, Pete. What have you been up to since we last spoke?
Well, obviously, seeing patients. I think COVID has actually magnified, I suppose, people's thought processes with regards to, I think, their own health. And I think importantly on that, I think what has happened with COVID is that there's a recognition that the NHS doesn't have the capacity to help you out. And I think people are looking for the alternative approach. And I think more importantly, recognizing that they need to take charge of their own health, which of course, whenever we deal with complex cases or complex patients, that's got to be the number one, is that your patient has to be the captain of their ship, because if they're not, it's really not going to work out so well. And so we've seen a lot of that, Al. We've seen a lot of uptake of inquiries from a point of view of, I've got this chronic disease, how can you help me out? So there seems to be a shift in mindset, which is good, because when you've been indoctrinated from a point of view of the NHS will help you out with regards to everything, you suspect that that's the way you're going to be treated. And I think we've moved from well, okay, I need to be the captain of my own ship. So I think from that perspective, we've seen definitely an increase in patients. But I think importantly, I've just developed the genetics panel and the training for DNA Smile. So that's the sort of major tick box for me, which has been a pretty long project, and that went live on Tuesday. So sort of chuffed on that, and now that's obviously got to be marketed over time. And I think what we've done, not just I think the panel, but I think the concept of some of the major theories and underlying mechanisms that, if you like, drive disease and of course drive health. We think that's all been included in the training. So very sort of systems biology, functional medicine, thought processes and approaches. And yeah, I think, touch wood, initially, I think we've started with some pretty good training, and I think a really important panel that, of course, is looking at the overwhelming relationships with poor oral health, and how that links into pretty much every systemic chronic disease, which is the really scary thing about it. Just how prevalent those associations and those relationships are, pretty frightening. So completely brings a new thought process about, it's probably a good idea that you look after your teeth and look after your gums, because if you don't, they're going to be building problems for later life, or if not already exaggerating some of the chronic conditions or chronic diseases that you've got. And it's been quite overwhelming, as you say. The evidence is spectacularly bad from a point of view of your risk. And that's a really crazy thought process around it. And I think is good for us, because, we are systems thinkers. So we're recognizing how something locally can be causing, systemic and distal diseases. And so that really is changing the way. I mean, we've been changing for many years, and I'm sure, again, with Health Path, we're on this. We're very much in this area of understanding host and microbe relationship. Who are we defending against, and how good are we at defending against? But importantly, what does our defense force look like And that was one of the key things that I wanted to do with with DNA Smile, the genomics panel, was not just to understand who the bacteria are, and again, who are I like to call it who's on the battlefield, and how pathogenetic are they, and again, if we take it back to, are they just basically soldiers out of basic training that really aren't going to be that damaging to us, or are they all special forces where we're going to have some significant problems with? So I've been very much interested in host microbe relationships for many years, and importantly, interested in barrier breaches. How do we defend against the outside world? Where does most of that defending happen? And what are the consequences of barriers being breached and compromised? So, this is your classical leaky mouth, leaky gut situation, what happens. But importantly, and I think what I wanted to develop with DNA Smile is get that much better understanding of what the defense of these individual defense forces are going to look like. Because once you get an understanding of what they look like, you have an understanding of how they're going to respond, but importantly, how you can treat. And that's what we tried to create with DNA Smile. And the mouth is for me, the mouth and the GI tract is not separate. So the mouth is is almost like the first major battlefield where humans taught to defend from the outside world, and it's pretty important. So I wanted to get an understanding of how all that works, and that was again, I suppose, like for most people that invent things or come up with things, for me it was very personal project that started in my mid 40s. So 7 years ago now, I just started having a problem with a back tooth, mate. I'd never had any problems with my teeth before. I was going to the dentist twice a year. She never mentioned anything. Good dentist. And then had a problem with a back tooth. Went to the dentist, and she said, Mr. Williams, it's going to have to come out. I said, okay, fair enough. Not really had many problems with my teeth at all. So why is it that it's got to come out? And she said, well, you've got periodontal disease, and it was, number one, anyone, I suppose, in our job, anyone who's told that you've got a disease is a massive shocker for you. But I think more importantly, the biggest shock was I had no idea what periodontal disease was. And I think this is, you can't know it all. And I suppose our job is a lifelong lesson of learning. And I had no idea what it was. So of course, huffed and puffed on the way home, and got straight on to PubMed, and then literally a new rabbit hole that I jumped into just opened up, because then I started to read the evidence and recognize that actually periodontal disease is a pro-inflammatory disease, seems to be this gatekeeper, this sort of gateway for other diseases to develop. And from that, it was like, holy cow. Okay, so, if I've got oral disease, my chances of being obese are 3 times more likely. My risk of having type 2 diabetes is doubled. And the list literally goes on. If there's a completely bi-directional relationship with type 2 diabetes and periodontal disease. So treat one, you treat the other. Same with rheumatoid arthritis. Periodontal disease, oral disease, and rheumatoid arthritis are literally identical diseases from a point of view of mechanisms of action, from a point of view of genetics, etc. And so I started and I suppose the other scary aspect for me, because obviously as a practice, and for me, I'm very much interested in early cognitive decline, cognitive deficit, and very early Alzheimer's. Obviously being Bredesen trained and being an early adapter of that, I've been very much interested in, how do we keep the brain healthy over the years, and the evidence coming out from a point of view of what are some of the major mechanisms that are contributing to cognitive decline and early stage Alzheimer's and dementia. We're starting to see this overwhelming evidence looking at how oral bacteria can translocate, because you've got poor dental health and you've got poor barriers, into the body and then can start compromising the blood-brain barrier. And then, of course, as you know, Alzheimer's is not a disease of creating these plaques, which do ultimately become the problem. But those plaques are created because it's the way the brain tries to defend against pathogens or bacteria that shouldn't be in the brain. And so, you know, it's almost like we talk about functional medicine or systems biology from a point of view of we always want to identify the root causes. And so the evidence is really overwhelming that periodontal disease, gum disease, becomes this gateway, this gatekeeper that many other diseases develop from. And once I started reading the literature and getting into it, I think about, and I think we all have this, when we get complex cases, we are trained in complex thought processes with complex patients. And I look back over that and I think about all those patients that I did quite a good job, but maybe didn't fully resolve all their symptoms. And I look back and I think I didn't even ask the question. It wasn't part and parcel of my sort of training remit to say, so tell me about your dental history and tell me where you are now. But, that is something that's absolutely standard of practice now, because you can't ignore the evidence about what this is showing. And of course, it just leads on to many of the things that I suppose like health path are involved with regards to, SIBO testing and GI testing, and getting that understanding, I think we're starting to see the evidence where, and I can think of some of my cases where you almost get this refractory SIBO, i.e. you just can't get rid of it regardless of how well you've tried. And again, the evidence is suggestive of, well, if you've got poor bacterial health, then, you're going to be swallowing 1.5 liters a day of bacterial pathogens, but not only those, the sort of the inflammatory molecules that your own immune system is responding to. And, as many digestive issues come from, most people don't make enough stomach acid. And these bacteria have the ability, and these cytokines have the ability to manage to survive the stomach acid, and then go on to become a causal mechanism in SIBO. And again, these links go on, and these links go into, we're looking at bacterial translocation, particularly one of them, Fusobacterium nucleatum, which is an oral pathogen. But we're seeing that seems to translocate through compromised barriers at the mouth and actually sort of slip down in the lymphatic system and then re-engage all over the body, in particular in the small and large intestine, where it's shown to induce colitis and IBD-like situations. So again, I think what we're doing with DNA Smile is, and just a general training in general, is, I suppose, trying to emphasize that the mouth is not separate to the rest of the gastrointestinal tract. And when we're trying to heal or look at people, whether it's SIBO, whether it's, it could be colitis or IBD or IBS, it's a question of maybe we might at least just ask the question. And I think that would be the starting point for anyone who's a practitioner or a patient is, how actually good is my oral health? Because it could be compromising or could be a major root cause of something more systemic. And as you know, Despina and Fusobacterium nucleatum is quite an interesting bacteria, definitely becoming more noted as a pathogen in the literature, and as you say, is induced in colon cancer, very much strongly associated there, but definitely with colitis, definitely with IBD, but interestingly, and this relates to Despina, who we know very well. She's one of our associates. She actually recently did her research at King's College looking at Fusobacterium nucleatum actually being a mechanism that is involved in breast cancer. And so again, what we're seeing there, and it sounds pretty crazy, doesn't it, that how does a bacteria that should stay in the mouth managing to get into tumors and breast tumors? And the reality of that is that, you know, this is the whole process of what I'm very much interested in. You know, we can chat to that because I know you are, and I know this is, you know, a component of a lot of the underlying mechanisms that drive some of the testing at HealthPath is that we're looking at not only our relationship with bacteria, but we want to know what are those bacteria staying in the places that they should stay? Because when they don't, and that could be because, you know, you've got poor, you know, again, just if we're relating that to the mouth, you've got gum disease, and therefore you've got periodontal plaquettes. Therefore, you've got, you know, your teeth bleed whenever you're cleaning your teeth. What you're doing there is you're enhancing already compromised barriers that allow bacteria to slip into your body and end up either, you know, as part and parcel of you know, breast cancer tumors. Which again, when you think about that, it makes sense that what happens whenever you have a bacteria that moves, if you like, and I'm going to say, because we know the gastrointestinal tract fundamentally is outside the body, when it moves from outside the body inside of the body, then your immune system inside your body recognizes that this is a bacteria that is in the wrong place and therefore needs to do something about it. So when you're looking at Fusobacterium nucleatum and its involvement in breast cancer tumors, you know, what is happening is, for some reason and some mechanism, it's got into the breast, and the immune system is looking at it saying, you definitely shouldn't be here. And it doesn't discriminate. It doesn't have a conversation with the bacteria. It already attacks it. And as you know, Al, when your immune system attacks, it attacks with chemical warfare, with increase in oxidative stress, and increase in inflammation. And all those are three, you know, distinct underlying mechanisms that would induce the sort of enhancement of a tumor. You know, these are all the mechanisms that we're looking at. And of course, they're the mechanisms involved with some of those underlying root cause mechanisms that are directly involved with pretty much every chronic disease. You know, we want to understand, and, you know, we want to get this understanding that to really go to the root cause of really trying to help that is that how do we go to the root cause and stop the bacteria's translocating in the first place? And that sort of brings us back to, you know, making sure that we've got that robust understanding of how healthy our mouth is. And all these processes, as you say, brought me to the fact that when I wanted to design DNA Smile, and obviously I didn't do the genetics to it, I approached several companies that I've worked with over a long period of time and say, look, here's where we're going. And it's probably for me, if I can just talk about certainly how we think with patients that come in, so I think it's quite important from a point of view of maybe where health providers are going and testing providers. Many of the patients that we see, and you will see, Al, are ones that have come to you because they've got a complex condition. There is, you know, to be fair, even from a point of view, from our perspective, can be really quite difficult to actually identify everything that's going on. But they may have gone to brilliant people who are conventionally trained, and they've done their work, but it's not quite working. And in fact, you know, they're still with their chronic disease. Many patients that we see have gone through that process. And when they come to us, sometimes it's quite simple of how we look at them now, because we ask the question likely is that if we are, as we know, more bacteria than human cells, maybe the first question should, and that the health of the bacteria that we carry is probably more, what's the word I'm looking for? And we really need to understand, because if we're more bacteria than human cells and that bacteria is not in great shape, then over 50% of our illness may be determined by those bacteria, and not only that bacteria, but the consequences of how our immune system wants to respond and defend to. So the questions I like to ask our patients is, maybe you are just a patient who is multi-systemic dysbiotic, and that's not just from oral, small intestine, large intestine, and colon. that could be sinuses. I mean, again, it could be urinary tract, it could be vaginally. And I think what we're learning is that it just isn't a surface that doesn't have a bacterial community. And so for many of the people that we see, that's the first question that we ask. And usually it's the question that's been missed. And usually it's the question that resolves a lot of the issues, as you will know, because and it's dominated by what is happening in the gastrointestinal tract. So you have all these old naturopathic legends, don't they, that, all disease begins in the gut. But I think it's probably certainly getting quite truthful that actually, yes. And it's not just all disease begins in the gut, but it's definitely, if we look at the gut, and I'm talking, I want to add in, sinuses. I want to add in, what's happening in the mouth. I want to add in the sort of, the tubes to the stomach and everything from that. Because I don't think we should miss out and just fully concentrate on the colon, the large intestine, where of course most of the bacterial species are. We are learning that we've got to try and control all the others. And when you have the testing and the processes to be able to do that, and the mechanisms and thought processes, I think we're changing a lot of how our patients' chronic diseases evolve, because we're thinking about the mechanisms of how we can control them, particularly through understanding the relationships with, bacterial species. And I know it's we don't have all the answers. And I think even with the testing that we've got now, we can't be conclusive with everything that we test. But I think what it is doing is giving us at least enough information to be able to take our patients down some degree of strategy over time. That's never easy. It's never an easy journey. But we've had some really fantastic successes with understanding those processes. And I think those processes are, again, host microbe relationship. How healthy is that? But then again, I'm looking at bacterial translocation. And so, leaky gut, and again, I think we've got to use our terms carefully, because the gut is permeable. It should be permeable, but it should be selectively permeable. And the story of that for me is always, as I say to patients, imagine you've got a really solid castle, but of course, and you've got lots of people living in that, but you've got people who want to bring food in every month, and that's got to happen for the health of the castle and everything that's around it. So you need those points on the castle wall where things can come in and things can come out, and you want to be able to do that all the time. So your gastrointestinal tract, there's a new one for you. Maybe there's a new test that we can develop on that. Is that we're trying to have an ebb and flow of things that we want in, but things that we don't want in. And so even if you look at and again, there's a lot of arguments about leaky gut doesn't exist, but again, for me, it's a terminology. That I like to say, when your gut is more permeable than it should be, then the chances of maybe having more systemic issues really goes up. And the DNA Smile that I've looked at is very much interested in some of those, if you like, soldiers that are patrolling the outside world and giving, if you like, the soldiers in the background a picture of maybe trouble is ahead by the way they sample the outside world. So these pathogen and recognizing molecules. And so the panel, again, that I'm very much interested in is what is happening on the battlefield, because a lot of the genetics that we've looked at on DNA Smile, not only are genetics that are determining how aggressive or not our own defense force is going to defend from the outside world, which is really important, because as you know, it's not just a question of the pathogen, because you can have people who have highly pathogenic bacteria, but their immune system responds really well to it. And again, this is Alessio Fasano's, gluten scenario, isn't it? Is that we know that gluten is an inflammatory molecule. We know that it's damaging, but we know we could have individuals who would eat it all their life, multiple servings a day, and never have any problems with it. So we know it's not just about the pathogenicity of the bacteria. It's a question of how does the host decide to deal with the bacteria, because that then gives you that understanding of, is there going to be problems? And so, you know, if I look at my problems from point of view of why is it and now as I'm in my 50s that, you know, periodontal disease has developed. Well, number one, for most people, it's completely asymptomatic, and that's what it was for me. And, you know, it's probably why the dentist never said anything. You know, I recognized I probably had a little bit of gum recession, but it really just didn't show its head, completely silent for me until that tooth started. And that's, for a large population, is that just it's an underlying inflammatory disease that just gently simmers and then pops its head out at certain times. Now, interestingly, if you look at some of the research coming from the US now, from the CDC and from the National Institute of Dentistry, they've just put some recent stuff up there, which is pretty scary, Al, because again, the key for me is that, well, you know, I didn't want to design a test or a genomics panel that wasn't going to be used that often. And if you look at the literature now, what they're showing is that in the US, over 50% of the adult population over 30 have periodontal disease.
Wow.
So it's hugely significant. And, you know, and even if you're sort of, imagine you've got a population group, you know, maybe you're a practitioner and your population group is generally 50 plus, and the numbers are gonna stack up. And so, you know, again, this all brings it back to, you know, how do diseases manifest themselves? And this brings it back to, again, how healthy are our microbiome? How well do they protect us? And wherever that microbiome is, again, I think we've got to get out of the thinking it's just sort of, you know, it's just in the small intestine. Well, it is in the small intestine, but again, small intestine is more about bacteria, and usually good bacteria, in the wrong place. So you've got the accounts team doing a design team, brilliant people, but making a mess of your business. But, you know, I think we've got to accept that we exist as a superorganism, so a holobion, and that holobion is determined, our health is determined by not just our cells, but how that over 50% of what makes us up is determined by our bacterial cells and our bacterial communities. And so this brings us back to, I suppose, how you will look at people, which I'm sure you do, and how I look at people. It is a question of, well, we've got to start thinking about how these communities are and how healthy they are, because we've got to know this host microbe relationship. We've got to understand how we patrol our barriers and what these barriers look like, and can we identify on an individual basis how we're going to respond. And so if you look at me and my gene panel on DNA Smile, I've got a hyper responsive immune system. And so we're looking in two ways. What I wanted to look at is the sort of innate immune responses. I'm very much interested in a receptor called toll-like receptor 4. And I originally got into toll-like receptor 4 because I'm interested in toll-like receptor 4 tags for LPS. And LPS is this sort of sugary like fat molecule that sits on the back of what we call gram-negative bacteria, and the immune system really doesn't like it. So it's a real big pathogen. And once we start getting too much LPS tracking into the body, immune system goes crazy. It can induce just to give you an example, and I'm sure you probably deal with quite a few of these patients, and people who are depressed because they're inflamed, and the predominant thing that is stimulating that inflammation is an overexpression of LPS, and they are people with overly aggressive immune systems that respond. And again, when those immune systems respond, they induce that depressive like, chronic fatigue like, pain like picture. And so that was my original interest in LPS, because there's two things that LPS does. Number one, it tags for LPS, but in certain individuals, they can have variants where it almost tags too well and then hyper responds to the immune system to say, have a guess who's coming over, and I'm going to amplify that message so that you amplify all these pro-inflammatory cytokines, and you're going to have a much greater response. What I was also interested in toll-like receptor 4 and why we put it in the panel is because toll-like receptor 4 very much signals for saturated fats. And in very basic terms, it sees saturated fats as a pathogen. And why I was interested in this, because I've got an interest with regards to cognitive decline and early stage dementia. And you're having many individuals who are suddenly just on a very high saturated fat ketogenic diet. And for me, that doesn't make sense in every single individual. And in fact, actually, I think it's a real risk factor. And that's why, again, you need that genomic information. And if that's tied in with ApoE4 as well, we're starting to get this picture that maybe you really do need to understand that individual's, genetics before you can truly personalize a program that's going to be appropriate for them, which is, of course, is what we try to do in every single patient. We're consistently trying to personalize their approaches on the effect that, as you know, it's incredibly complex to get it right. And the reality is we can only go so far, noting that there may be some things that we just miss or we're not aware of. And so I'm very much interested in some of these genes that have these, if you like, these soldiers that are looking out into the outside world, onto the battlefield, and I want to know, number one, how they're responding to the battlefield, but importantly, whether they are an individual soldier that is not really going to report back what's going on, or is going to completely hyper respond. And then, of course, that hyper response is how it tells the immune system to ramp up the resources and ramp up the soldiers in the immune system. And unfortunately for me, I have a lot of pro-inflammatory cytokines in the panel. And what that means is that if there is more than normal bacteria on the battlefield in my mouth, or indeed just normal levels, I am always going to respond in a hyper responsive state. And that unfortunately predisposes me to the periodontal disease, but of course then predisposes me to all the other pro-inflammatory diseases as well. And so we're trying to make the connections with regards to all of them. We're trying to bring out many diseases: rheumatoid arthritis, dementia, obesity, type 2 diabetes, you name it, everyone has a relationship. I mean, even some of the relationships with regards to cirrhosis of the liver, all the sort of, a lot of the IBDs, colitis type, all have this real root branch and root causative factor where we've got to bring it back to the mouth. And so we're very much interested in that. There's some fascinating things that we're only just reading about that's just come out, which is really about how, I'll probably try and explain this in very simple terms, what is happening in the battlefield and how your immune system not only goes to battle, but also relays messages back to the sort of the command unit, about this is what's happening at the battlefront, what should we do next? And what we're finding is that some of these periodontal pathogens are stimulating some of our immune system, like particularly like IL-6. And IL-6 is, of course, is traveling around the body and is going back to the bone marrow where we make our, our white blood cells, etc. And it's almost talking to the right white blood cells, that production line, to saying, you know what, that battle was really tough. And maybe what we've got to start doing is making even more cytotoxic white blood cells that can go back to the battlefront and actually start causing more damage or to defend across. And of course, what we're learning about this is absolutely what's happening. And these new white blood cells are becoming more aggressive. So as the battle rages, the signaling goes back and you as a human start making more white blood cells. But the memory is saying, the relay is saying, battle is still raging, let's make them more and more cytotoxic. And you end up with patients, whether, again, it's particularly with something like rheumatoid arthritis, if you don't start sorting the battlefield out, if you don't start closing the barriers, that signaling process amplifies and amplifies. And so it's this process is that if we did something locally in the mouth, it's going to start calming down the distal aspects of the disease. And so we're definitely seeing you know, just an example, IL-6, if it gets more and more signaling from the battlefield, it starts to talk to the bone marrow, and the bone marrow starts making these other proteins that come back to the battlefield, and maybe that's the periodontium or, you know, the underlying bone, and, you know, they start talking to some of their pro-inflammatory cytokines like IL-17, and what that starts to do is create actually more. IL-17 is one of the genes that we're looking at some of the variants, because number one, it's associated with periodontal disease. It's also very much associated, as you know, with increased risk of autoimmunity. But one of the other things that IL-17 do is that it'll start talking to bones, osteoclast bones, and make some of these immune proteins actually more osteoclastic in nature. And that's part and parcel of the sort of periodontal disease. It's, you know, these signals are becoming more and more aggressive, and more, if you like, more and more where they start to make molecules that tell the bone to break down rather than build up. And why is it doing that? And again, it's because that's the way it sees it should be defending itself. And this is why, again, what we're trying to do is really try to, in very simple terms, if, you know, it sounds all, this is all really complicated, but the reality is, when we bring this down to absolute basics, you've got to start looking after what's happening in your mouth. And that comes back to all the fundamental basics. You've got to clean your teeth well, you've got to go to the dentist, you've got to have the right diet. You know, these diets need to be rich in plant foods, because the plant foods change the microbial communities in your mouth, and they have lots of molecules, particularly the polyphenol groups, the flavonoid groups, that actually start altering the battlefield, so that battlefield becomes less of a compromise for, number one, how your immune system is going to react, but importantly, how things are going to slip out the barriers. And of course, if the war continues, you can't ever repair the barriers, because you've got to start reducing what is happening on the battlefield. So that fundamentally is what we've gone on to do. We've gone on to create a genomics panel. There is really giving you this, and the training, of course, which is sort of a culmination of much of the stuff that we've talked about. Because what I've wanted to do is not leave people with, so here's the test, off you go. I've tried to show it how it applies in clinical practice. And I think importantly for both patients, but importantly practitioners, I think this is moving, I think we're moving into an area where we are bridging the gap between specialities. And I'll give you an example of this, because we've just, myself and a dentist called Dr. Victoria Sampson, I approached her to help me with a rheumatoid arthritis patient. And the reason why I wanted that is because I was convinced that the main root cause of her rheumatoid arthritis symptoms and disease progression were what was happening in the mouth. And this was a patient that had been treated by another really good functional medicine practitioner for over a year, really, you know, really dug deep into it, and really didn't get really too much change from all the interventions. When she came to me, in fact, she was getting worse. And again, through no fault of the other practitioner, I actually think they did a really good job. But she was probably in the position that I was in many years ago. And that's like, well, you know, didn't even ask about her dental health. And this is a patient with really quite severe periodontal disease. And for me, it was very simple. It's like, I think this is the major problem. I think there's a real war raging in your mouth. And unless we get on top of it, we're gonna be in a real situation. You know, this is a woman walking around with a CRP of 25. You know, so we know there's a lot of stuff going on from an inflammatory perspective. And so me and Victoria, I approached Victoria to say, look, here's what I want to do. Here's what I think we need to do. This is what I need you to do. I need you. And she's I mean, again, interestingly, when we wanted to put her when we were working on the process of presenting, I said, how do you want to be called? And she said, I want to be called a functional dentist. And what I think is interesting now is that dentistry is having to recognize that what they're doing actually is no longer just about the mouth. It has a responsibility to the whole of the body. And I think what we're looking to do is bridge this gap between dentistry and dental hygienists, and functional medicine or nutrition to say, here's how we bridge the gap, because this is really, really important. So I just want to go back to that rheumatoid patient, because we literally reversed. We put her rheumatoid into pretty much remission within 14 weeks.
Wow.
So yeah, she went from a CRP of 25. She went from really right-sided, a lot of neurological issues, swollen joints. She had a Baker's cyst on the back of her right knee, really swollen. And we just managed to get on top of things really quickly with a very simple anti-inflammatory approach, but approach that was dedicated to trying to sort the mouth out. And we did it so well that we actually thought, we should try and write this up. And we did. We wrote it up as a case study, and we actually got it presented at the recent IFM international conference. So we're sort of really proud that, number one, it was good enough to be presented at on such a big stage. And what it gave us the confidence is that there's a massive appetite, not only in the scientific literature now, but also with organizations to think about, this needs to be joined up, and how do we join up? So what I also wanted to do is give people that opportunity to say, not only have you got an opportunity here from a point of view of understanding a different aspect of systems biology and how it fits together and how it's all related to host microbe and the relationship around barriers, you've got an opportunity from a purely business perspective, because it's untapped at the moment. And we've been working with some of the best biological dentists in the country about this, and they're absolutely thrilled that we're trying to transition. And the reason why they're thrilled is because there's a lot of the sort of nutritional therapy aspects that they just can't do legally. And they're absolutely desperate for it. They're absolutely desperate for joined up thinking, because every time someone opens their mouth in their dentist chair, they are getting a deeper understanding of the links between the state of that health and whether there is disease there, and linking that back to whether it's type 2 diabetes, whether it's rheumatoid, whether it's obesity, whether it's early stage dementia. And so that's really where we're at, Al, which again, as I say, I think really ties into Health Path as a company, because again, you're dedicated around this understanding of, actually maybe we should think more about what's happening microbes and that interface, rather than maybe, obviously we want to take care of the other side of the aspect, which is what is happening to our human cells, but we've really got to think about humans in at least in a 50-50 split. And so that's where we're at currently.
That's amazing. There are so many questions and thoughts that come up. I don't even know where to start. But I think one of them, Pete, is because I think this is a really big element of it, which is, as you've been discussing, the relationship between sort of the organisms that we host. So I'm just wondering, is there a little bit of additional kind of context that we can explore from that perspective? What's our understanding of what drives that relationship, apart from maybe the genetic predisposition where we're getting this kind of hyper reactivity? Is there anything else that we can flag there?
In what sense, mate? You might need to guide me on that question.
So I guess, are there things apart from genetics that influence how responsive or how reactive we are to these organisms?
Yeah, I think there are many things, aren't there? I think this is where you're always trying to modulate the systems approach. And I had a conversation with a patient a couple of months ago to say, look, treating you and treating humans is a very dynamic picture. And there are things that are going to influence us on a day in, day out basis, whether, i.e. you haven't had enough sleep, i.e. you've had a highly stressful situation. These are all influencing and modulating that host microbe response. And I think importantly, one of the major important things for me is that I bring you back to, you must have the appropriate diet to be able to modulate that response as well. So, and there are certain things that you can do and certain things that you shouldn't be doing on a lifestyle that is good, that is going to change that result. But it brings us back to, and I think, we've done all this training, we've been in this, nearly a quarter of a century now, developing the systems biology approach, but it fundamentally brings back the crucial importance with regards to why the basics matter so much. And this is not so much about the host microbe relationship on your question, but I think it's important that as functional medicine and systems biology gets more, it's more visual to the general public, I think we've got to be very careful that the general public doesn't look at what we're doing from a point of view of an old allopathic model. And that is, we're going to do a test with Alex that's going to absolutely sort my gut out. I might have to take a few supplements and I might be sorted. You might have a patient that is the case, but they'll be rare. And this is the thing about, we've got to bring you back, as you'll have conversations with patients all the time. Yes, we are identifying things that aren't right, but that's because you're not doing the fundamental basics correct. You're not exercising enough. We know that more people who exercise have a better microbial diversity. And again, it's all of this thinking about the whole rather than the singular, because you're never going to be able to know or influence all the modulating factors, all the underlying mechanisms, all the pathways that go on to change that host microbe relationship. But if you do the fundamentals well over time, then you're going to be doing the right job. What I don't want patients to do, and it's a conversation I have with all of them, a test is only telling us where we're at and what's going on. Then we've got to evolve that from a point of view of what aspects of your lifestyle are making that, making these test results show what they show, because it's the context of your life that drives some of these responses. And unless we can have you moving away from some of these things that maybe are counterproductive for you, we're never going to get ultimately the results. And the test is just telling us, number one, your genes, but how you choose to live your life. And that's in a sense what the test shows us. And so we've got to do all the things that could control that. And for me, it's fundamentally the basics. It's quite incredible. And I don't blame patients for that, because I think we've just evolved now into a world where it's almost impossible to have optimal health. And it is what it is. And I think there's a component of that we have to accept that that's the case. And, and we're always trying to catch up. And it's very, very difficult. But because of that, it's so important that you at least do the basics well. And all those basics are free. And so, looking at how your behaviors are determining the context of the test results, but importantly, that host microbe relationship is determined by, for me, where you get your most results, your most bang for your buck, is usually when a practitioner tells them that the basics need to be done well. And I think this is interesting about behaviors and patients. I think sometimes because they don't have to pay for that, i.e., getting a bit of sun on your skin is probably the best thing you can do. Taking a walk, it's that they don't, it's almost like, the Stella Artois advert. That's how I look at it. It's like, well, because I don't have to pay for it, I'm not less likely to do it, and I think that's something I've not quite fully been able to understand and transition my patients through yet, because, we're complex. And sometimes, the success that we will have with patients is being able to understand better why they would choose to do behaviors. And I think this what comes down to, it's better to know the patient than to know the disease that the patient has, because you've got to understand on a day-to-day basis what's happening. How is your life living, and how can we control and change some of those fundamental basics that may be underpinning the mechanisms that are driving why you're not so well. So I think that was a sort of completely round the buses, round the M25 answer to something that I may not have answered correctly for you, Al.
No, I think if I had to answer that question, I think it would be very similar in regards to just the importance of the foundations. I mean, I did my master's dissertation on glucocorticoid resistance, or cortisol resistance in chronic fatigue syndrome. So something that popped up for me was this idea that obviously cortisol is such a powerful immune modulating anti-inflammatory hormone, but
absolutely,
under any chronic stress, we can develop this concept of cortisol resistance, like we can develop insulin resistance, and that's then going to have an impact on host microbe relationships.
Yeah, absolutely. Yeah. I mean, that it's such an entangled web. I mean, there are literally thousands of mechanisms that could be at any one time playing out to make it either, you know, a pathway towards health or a pathway towards disease. And I look at that, and you would never be able to identify them, but you know that some of the fundamental basics, some of these absolute pillars of health will take care of significant components of that aspect. And so I think patients have to recognize that, you know, that information that you're going to go, well, I could, you know, anyone could have told me that. Well, yeah, anyone can tell you that, but it comes back to, you know, the development of the oral test here is that in a sense, this is still taking you back to, you need to be doing the basics of what we understand for good oral health well. Because if you're not, you're going to be in trouble. You need to clean your teeth twice a day and do it well. You need to floss. You know, you need to go to dentist twice a year so that you're finding out how, you know, where the battle is. You know, are we winning? Are we losing? You need to be into a dental hygienist. And it's become so important when you look at the literature. I mean, again, I can just think about the evidence of, you know, increase in gum disease with regards to cholesterol levels. You know, because we have a model of how we would traditionally treat cholesterol levels. And I've had loads of patients where when I start seeing high cholesterol levels, my next question is, so, you know, what's your oral health like? Because the evidence suggests if you can calm the periodontal disease, the gum disease, you will change what's happening from a point of view of, those sort of ratios of cholesterol molecules, the LDL, HDLs. So we know, it's this really big aspect of local, systemic, and, you know, what is happening from that perspective.
So I just want to touch back to one thing you mentioned earlier with the example of Fusobacterium, because that really kind of, I guess, well, everything has piqued my interest, but that particularly did, because I've had 3 clients now, I think, who we look at Fusobacterium species within our stool test. And on 3 individuals where that has come back noticeably elevated, we've done an oral microbiome test where Fusobacterium nucleatum has been significantly elevated.
Right, interesting.
Really interesting, obviously, correlation.
Yeah.
And just, did you say essentially that one of the things that can happen is that this organism can enter the lymphatic system, get transported, and then essentially end up in the gut as well?
Yeah, so I think there's two ways where it goes. Basically, you swallow it, which you will do. And of course, this comes back to if your stomach defenses aren't good enough, then it's got more chance of getting through. And I think we would suggest that we see many patients and you know, general population who are probably don't produce a lot of stomach acid, or indeed don't produce any. So slipping through more easily. So it can go just from a physical, as I said to you, you know, disease can be stimulated simply by gravity. So you're swallowing things. But the other thing seems to be, again, it's the barrier compromises. Is this Fusobacterium nucleatum is slipping. And again, it's implicated also in dementia. It's also implicated in breast cancer. It's implicated in colon cancer and colitis. And what they think on those aspects is that it gets into the lymphatics, travels around the body, and parks itself up in many areas. But one of them, of course, is back into the gut. And that's what we're seeing. So, you know, but again, that question comes down to, Al, again, it's that how does the host talk to that bacteria? So I think you are suggesting that by statistics, the risk is increased. But then you've got to try and get an understanding. Well, how is the host going to react to that? And again, this is where it's your problem is going to end up either with a host that doesn't react at all, or one that it's hyper responsive. And you know, that's the interesting thing, isn't it? Is that, you know, there are no good or bad genes. You know, you are a product of your ancestors, and for many, you know, I suppose if you look at, you know, the ApoE4 genotype and pro-inflammatory genotypes, you were the people who were probably actually, you know, given that we probably lived to mid-30s all those years ago, you were the people who probably got to mid-30s because you had this really hyper responsive immune system, because life was tougher. You were exposed to more pathogens, bacteria, more likely to get injured and cut. And that was more of a number one, an immune system that's more aggressive because it had to do more. And so, you know, they're unfortunately the people who hyper respond, more likely to have the sort of chronic, the disease pathology, and the sort of dementia, sort of Alzheimer's picture. But going back to it, really interesting again, that how is it getting there? And that's, for me, would already start thinking about, is there, what are the other family history risks? Is there a history of IBD? Because you're already thinking about additional mechanisms that may be inducing that. But it brings you back to, well, how do we treat? What's going on? And is this a combination of we need to get a dentist involved? Is this a combination of we're going to have to think about how we change the microbiome in the mouth to try and get on top of that? And ultimately, do we need to think about the diet? And very interestingly, Al, I'm speaking to a lot of really great dentists, but also really good hygienists as well. And they're talking to me about mouth breathing. They're talking to me about aspects of hypoxia inducing bacterial dysbiosis in the mouth, so mouth breathers at night, all of these aspects that, again, are new to me from a point of view of, and they will be changing the bacterial balance. And of course, we're also moving into metals in the mouth and amalgams and how they change their oral bacteria. We've actually also put an add-on to the DNA test, which is also looking at, because I wanted to get a better indication for everyone when they answer that question, should I have my mercury amalgams removed? Which I don't think is a simple question. So what I wanted to do there is start building and working with dentists and the literature to say, your ApoE4 doesn't do very well with mercury at all. Your poor detoxifier as well. Yeah, probably the evidence suggests, both genetically and the science, that maybe that's something you would need to think about with the appropriate people at the appropriate time. So I think there's a lot of, let's get rid of everything. And I'm not so sure that's a smart thing to do in every single case. I think there could be trouble with that.
Okay. So you're talking about, in some ways, there are certain people who you might want to sort of lay some foundations and get improvement and make them as robust as you can before you then actually would do removal work.
So it's a great question. And I think it's very difficult to answer, because you may have a patient that is so far down the line that the major root cause of why they're so far down the line could be the mercury amalgams and the potential pathogenic effects of that. So I think that's a question. And I'm not quite sure on an individual basis how you answer that.
Yeah.
But what makes sense to me, as you've said, and I think this is probably from our training, because we did a lot of detoxification in the advanced practice modules. We did a lot about mercury, heavy metal chelation, and it's not a subject that is you trust willy-nilly. We as a practice do not do any of that, because we don't believe that we are qualified enough with enough experience to fully understand the mechanisms. And I believe that if inappropriately done, is going to cause a whole host more problem than not being at all. I think your other question, again, it's that host, the health of the host. There sometimes is a tipping point, and may have people who have, a lot of mercury amalgams, but their detoxification capacity is good and their overall health is good, that they actually can keep going in a sense. But you're going to have patients who aren't like that. So what makes sense to me, Al, is that you try to get your patient much healthier first before you entertain that process. And that's what would make sense to me. But I think I think we're completely open to debate, and it's a new area for me from a point of view of a new area of understanding. But it's not an area that should be taken lightly. And I'm slightly concerned by some of I've been doing a sort of little bit of sort of silent Facebook account watching, and I think through no fault of their own, the general public are, so everything needs to be removed, blah, blah, blah. And I think it's, why would they know? It's really not as simple as that. And I think the risk is you could cause more damage than good. And so I would like to maybe move into that area, simply because I see too many people with the greatest of intentions on their own. It's that patient trying to go down the pathway that may be slightly ill-informed with the information. And I think that's risky, unfortunately.
Yeah, no, it makes complete sense to me, really. And I'm fascinated at the moment by this kind of concept that the amount of whatever you want to call it, I guess, imbalance or damage, if we're talking about kind of neurodegenerative stuff in the brain, there's not even a direct correlation between that and sort of the severity of symptoms or dysfunction that that person's manifesting, which itself is kind of just mind-blowing.
Yeah. And I think this is the crazy thing, isn't it? Is that, you know, you're going to have these patients. It's a bit like, well, you know, Uncle Johnny smoked, you know, 2 packets of Woodbines all of his life and lived to 100. And I look at that from a point of view of, you know, I suppose that what I call a total toxic load theory. And that is, what are you exposed to and how well can you get rid of that load? And I think we're always on the balance of that. You're going to have some people with minimal exposure, but really poor capacity to deal with it. And they maybe are the ones that are really in systemic trouble. And so, yeah, I mean, it's a fascinating area. I don't know the answers, Al, but you know, this is the thing. There's no logic, is there? There's no, and that's what's difficult trying to give patients an understanding to. It's like, you know, you have these patients with massive infections that can just, you know, all right, I feel a bit grotty, but I'm fine. And you can have people with small infections and, you know, they go on to have, you know, chronic fatigue syndrome and never come out of it. And I just don't think we know, but there's clearly, as you say, that's why I think understanding more about host, certainly more about our immune response, I think is quite important, because that's given us more indications of, well, of course you're going to react like that. You know, because I think about some of our patients at the moment who, you know, are having the vaccines and having the jabs, and some it's not a problem. You know, I feel fine. And then the others, like I've got one patient at the moment, she's been struggling for 2 weeks, you know, really with that classical, almost like chronic fatigue syndrome from the jab. And, you know, why is that? Is that because she has a really, really profound and aggressive immune system that is really going to town with regards to what the vaccine has given her? And I think this is why it's so important that we try to practice personalized medicine, because, you know, someone is going to have a completely unique response. And you know, and you're going to need, it's like when we work, isn't it? It's really, from us, the amount of background thinking and work that we think about with each patient is you're never off it, because you think, well, why is she reacting like that? You know, well, why is he, God, I mean, God, look at the state of this. And this guy walks around, you know, clicking his heels on the path all the time. He feels absolutely fantastic. And so again, yeah, I think about that all the time. And, you know, and I always go back to Fasano's gluten lecture that I went to over 10 years ago. And he said, you know, damaging molecule, pro-inflammatory molecule, but you're going to have individuals where never ever causes a problem with them. And that's because it's not just about the invader, the pathogen. It's about the way your body talks and has the capacity locally, but systemically to deal with it.
Yeah.
And I think that's why that's why it's a struggle sometimes, because you can never give your patient an absolute, this is what we expect. And that's what makes it difficult for them to comprehend as well. That's why it makes it difficult to deal with, because everyone is going to respond in a different way.
Yeah. Yeah, and it actually is one of probably the most important points within the conversation of just functional medicine and systems biology, this concept of there is no absolute. And I think the challenge with that partly is we all seek security through certainty. And if we can't have that certainty, especially with something as important as like our health journey, that can be challenging to accept. That can almost be destabilizing.
Absolutely. And I think this is the skill of the practitioner, to be able to tell that what you've just said in a way that doesn't put them on a negative, doesn't say, so I'm going to pay you all this money, you've accepted that you're going to have to look after me for a period of time, and you can't give me any guarantees or certainty about what's going to happen. And I think that's the art of being able to bring a conversation over to them that really makes them feel like you're reaching for the stars with them, but also allows them to just have a little bit of understanding that it may not go the way that we think it's going to go. And they've got to be good with that. But it is difficult, Alan. I think that's probably one of the major and it's not a sticking point, but I think that's one of the major concerns with regards to maybe the way functional medicine practitioners have to talk to patients, from a point of view of, you know, you're going to want how do you give your patient certainty in something that you can't give them certainty with? It's very difficult. And so, you know, it's a very difficult conversation to say. And you want to motivate them. You want to feel as though you've got them, you understand what's going on. But also that is within the remit, as in, we may not solve this. And to be fair, you know, I've had a couple of patients in the last couple of months where, you know, I've just had to say, I don't think I can do any more. And, you know, I've done the best I can. And that hasn't been good enough in this occasion. And so, you know, we need to shake hands and accept that, you know, it hasn't worked out. But the more complex cases you have, the more likelihood that that is going to happen. And, you know, and that's the difficulty of it, is that, you know, I suppose also being honest to your patients about what success looks like, I think is quite important to be able to do, you know, because you have this understanding based on the way they live their life and maybe the disorder that they've got and the time frame you're working in. What success looks like to you as a very experienced practitioner may be different to what your patient thinks success is. And again, that's where a really good and honest conversation that is very positive at the beginning matters, because you don't want them going down the line thinking that this is success and this is actually what success looks like. So for many of our patients, success for us over a time frame is making sure they stay still, they don't get any worse, because you're doing all that deep, meaningful sort of relaying new foundations. So if you can keep them on a level playing field, you know, it might take you 3 months, 6 months, but you've done a brilliant job. And it's like, again, it's being able to take them along the path, take them along the story to say, you know what, it might take us 3 to 6 months. And you know what, we might not see anything, but we've built the foundations, and you've got to accept that that's the time frame. And from there, you'll really start to see the change. But it's an appreciation to patients that they're going to invest a lot of time, a lot of finance into that process. And very rarely it doesn't work out. So yeah, I mean, you know all too well. I think anyone who's been in the business for quite a long time knows that a lot of the time it's not just about, well, it's very rarely about the testing. It's about how you skillfully take someone in a relationship down that pathway that is honest and truthful to them.
Yeah, I think expectations is something we've spoken about, I think, a couple of times off air as well. And for me, going back to the concept of one of the main themes of today is kind of everything is relational. So, you know, this relationship it's everything ultimately. Relationship we have with our environment, etc. Kind of, it goes down to a cellular level, but it goes to the kind of the universal level as well. And I think
absolutely, Al, and you know, you can relate this problem to what we're doing to the planet. You know, not only are we reducing the diversity of all our vegetational species, it's exactly what we're doing to humans. And that's a major component of it, is that if you damage the planet, you know, the whole point is like, you know, if you continue to destroy the rainforests, which is where most vegetational diversity is, it some way, shape or form, it has a carryover effect on what we're doing to humans, because that's what we see. Because we know that one of the key, as you will do on one of your tests is one of the key markers that we use for health. One of them is microbial diversity. And that's very simple, because if you've got a rainforest and you have a bacterial assault, or, you know, a viral assault, or however you want to do, or a fungal assault on that rainforest, it might kill a few species. But the rainforest is so diverse and rich that you don't really see the change. Now, if you've only got a cornfield and something destroys the cornfield, the whole cornfield goes. And I think what we are doing slowly and insidiously and don't realize is that the more we chop down vegetation, the more we're going to be reducing the microbial diversity that humans exist with, because we're damaging the soils. We don't have that relationship with the soil anymore, you know. And you know, I'm glad I got a lockdown dog, because she licks my face every day, not only to bring her, and she's always licking a bum, but you know, I'm not being silly from a point of view of, I'm probably doing a really good job from a point of view of increasing microbial diversity to me, because the dog licks my face. And I take you back to one of the best conference lectures I ever saw was through Yehudi. It's not Shoemaker. He's the godfather of autoimmunity. Really old boy, and I can't remember his name. Yehudi begins with S. But anyway, it was one of the IFM conferences. It was autoimmune conference, and he did this most wonderful speech with regards to, you know, the science and how we understood autoimmunity. He was one of the guys who basically discovered it. But he ended the lecture with basically him and his granddaughter in the operating theatre, pictures. And what he was doing was, because she had to be C-section, what he was doing is taking some of her vaginal juices and smearing it over the baby. And, you know, just think, wow, what a beautiful thing to do, because he understood the science of what that did, you know, and how that is planting this rainforest into his grandson, which I think was like properly cool. And then what he also did, he took another picture about a few months later as the toddler. And of course, the toddler was like, you know, they had the dog and the dog was coming in and licking the toddler's face. And again, you know, beautiful thing to watch. But also, I mean, you could spend your whole life talking about why that is such a great thing to do from a point of view of science. Yeah. And I think we've got to do more of that, because I think, you know, unless we do change what we're doing with the planet, you know, it has a direct effect on us, because we're all comes back to your point. Everything has an influence on us. And it's not only, as you said, it's a wider picture, it's a bigger picture, you know, and it comes back to how we exist on this planet.
Yeah.
You know, and I think we really do need to think about that.
Definitely. I think it's such a key point. There's a statistic I stumbled across. I'm sure it's something like 75% of the world's food supply now comes from about 7 grains and 3 animals or something like that. And it's just horrific to think, ultimately.
It's not good. And you cannot, you know, you can understand how my wife was, she was a public health nutritionist for the NHF years ago. And she would come back every night completely frustrated with working with, you know, low socioeconomic status people, you know, in poorer areas, from a point of view, they just had no understanding of what was good food. And why would they? You know, because we don't give them that information. And so it really is quite a sad state that I bring you back to what we said. It's almost impossible to create optimal health these days, you know, because we're so influenced in, you know, in factors that, you know, we take, oh, that must be true if that's the case. And it's just not, you know, and it's sad. And as you say, if that's all it's left, you know, you cannot have health. You can extrapolate straight from that, Al, to say, if you're half bacteria and, you know, you are dominant, you know, if inside we have these rainforests of such infinite size, and every year we are bringing them down, we can't have health. And we're going to see, again, this is why I think we're definitely having more and more epidemics. Because people don't know the relationships yet, and I think the way the world is, it's massively affecting that. You know, the way the soil is treated, you know, pesticides, insecticides, etc. You know, environmental pollutants for sure. There's no doubt. Of course, we can't ever say, well, this one's causing the problem, because when that comes in, it will speak to your body in infinite pathways we don't know. But you know, when you start looking at the studies, again, I always remember the IFM training when they look at single heavy metals, and then you put another one in it, and the sort of synergistic effects of how those two work, it goes from, okay, a little bit then to just an infinite problem. And you know, and we're full of them. And you know, and that's why simple strategies like making sure you go in the toilet, being able to sweat more, you know, all these just infinitely simple strategies that may sound, you know, oh, look at Al in his sauna. You're not doing that because you want to look cool. You're doing that because you understand that this is actually a really important pathway for my body to stay healthy. We're designed to do that, you know, and you know, when we sweat, there's ample evidence showing that it's a really good detoxification pathway, particularly for heavy metals.
Yeah. You know? Unfortunately, I would say one of the most common symptoms I have seen over a decade is my client base just never sweating. Like they can't. They find it so hard. They're running cold, basically.
Yeah. Yeah.
So it's just a double whammy.
It's a double whammy from a point of view of, I look at obviously on the Alzheimer's side, and there was a study that came out in 2018 that looked at Norwegian men, middle-aged men, and basically it showed that that the amount of saunas they took in the week was proportional to their increased risk of dementia. So the less saunas they took, obviously the more saunas they took, the less risk. And it makes complete sense. What are you doing? You're sending blood flow up to the brain. The brain is allowing, all those pathways to be proliferated with nutrients and oxygen. And it's also taking the rubbish out. It's not rocket science on that. But again, it comes back to, we've created a world that, a very obesogenic environment that is almost impossible for us to stay healthy. I mean, me and you probably are more informed than most about what we need to do, but it's a day-to-day struggle.
Yeah.
Even with all this information, it's a day-to-day struggle to try and keep it going, and put it all together. And, I mean, I would look at myself at the moment and say, yeah, I do a pretty good job, but I wouldn't say I've got that absolute optimal health. I'm trying bloody hard. So I think back about some of our patients, think, Jesus, okay, they must be really struggling.
Definitely. I think it seems to me the balance between kind of learning and unlearning, coming back to some of those basics, because it's just amazing to me that we now know obviously more than ever before, and yet really as a trajectory at a population level, it's still going down and down and down in regards to health status. So do we really need to know more, or actually do we need to come back to some of the stuff that we just intuitively knew and did, and the lifestyles that we used to have, so those foundations are optimized ultimately? So some of the more fancy stuff, if I call it that, actually has a chance to work and get us into those more optimal brackets of health.
So I will give you, I always put a slide out which succinctly explains that, and it came from that 2018 conference, which was probably the biggest autoimmune conference in the world that year. And I'd summarize the whole 5 days of that conference, and it came from a geneticist's lecture, because you go to some of these conferences, and this was a lecture just showing how smart we are as scientists. Look at what we're doing with artificial intelligence and big data, and how we can integrate that with DNA and the microbiome. And it was hugely impressive. But if I could summarize the whole 5 days of that conference, it came down to two messages. Number one, if you want to reduce your risk for autoimmunity, eat more plant foods. And number two, let the dog lick your face. And that was it. And so it does. But I think what we need, as you say, and this is how do we tell the story? Because what we're doing is, what I try to do is get the very latest literature, which always, because then your patients think, oh, wow, I went to see this guy and he showed me this brand new paper that literally just come out right at the forefront of the science. But you can always translate that picture and what that research is telling you absolutely back down to these fundamental basics. Let the dog lick your face, and eat more plants. Boom. 5 days worth of incredible lectures. Some of the best. Schoenfeld was the Yehudi Schoenfeld. Was the guy, telling you that. And I think this is it, is that I think we've got to be careful that what we want to do is use the best of technology, the best of science, but then always bring it back to granny stories, because most of those are true. That's the thing about it. When you look back, you're like, it's true. Yeah, that was true. All disease begins in the gut. It's quite difficult to not argue with that. I wouldn't say all disease begins in the gut, but, if you started treating that major interface of where humans speak to the outside world, we could break down that in over many days and say, yeah, okay, there's a really good argument for that in the science. Mm-hmm. And I think your job with your health path company is to provide all of that in a really good storyline to say, yeah, we want you to understand this area. We want you to understand it better. But then we're going to give you the storyline and you know, the information in a document so that you can go away and do that in a, you know, on your own. You can be your own captain of your own ship, which is ultimately what's going to happen. You know, I think particularly with the NHS over the next couple of years, you're going to have to do that, you know, because they're so backed up, and will be for several years to come. Is there's just not going to be any room for basics, and so you've got to start your own. And I think we're talking about the vaccine. I'm just disappointed that there isn't a double message running alongside it. Yeah, vaccine, brilliant, great job. Again, we can argue about population groups and who should have it and who shouldn't have it. But yeah, no problem on that. But maybe we should run something alongside it that is really important. And maybe as in getting as much notice as this, that is, and here's what you need to do on a daily basis to really make sure that your health and your immune system is more robust. Because the more robust it is, and the more you do day in, day out, the less likely you're going to have an exaggerated response from COVID. But they don't. And I think there's a long way to go before this sort of joined up approach continues. We're definitely on the route. You know, if we were talking about 10 years ago, there's really not a lot of this. It was very specialized, and it's really accelerated over the last 5 years. But it's still not there. And it will take another 10, 15 years before we really start getting that message out that actually you've really got to do the fundamental basics well. And we owe it to our kids as well. Now you're a dad, you know, you can think, holy cow, you know, I need to start thinking about what's happening to these as well. You know, I can't have them, you know, existing in a life knowing what I know. And because, you know, I have a responsibility as a parent to bring him up in as healthy as way as possible. That's my role. That's my job. And it's not easy for parents as well.
No.
You know, so yeah, I think there's got to be this groundswell and this push for us to develop that in a better. And, you know, I think you guys are doing a really good job on that side.
Thank you. Likewise. Pete, I'm mindful of time. We could talk all day about this stuff.
We do. You probably need that mid-afternoon nap with the youngster.
Yes, please. But thank you very much for sparing time to come on. It's always an absolute honor to pick your brain and to hear you speak about something you're so passionate about.
Thank you, mate. Real pleasure.
Brilliant. Thanks, Pete.
Cheers, mate.